Hi guys, today's topic about trigeminal nerve or cranial nerve 5. This trigeminal nerve, tri means 3, gemini means tunes, means 3 branches, tune 3 branches. So tri means 3 and gemini means tune branches. It means trigeminal nerve comes from this little words. This trigeminal nerve having two component. It's sensory and motor. It is missional. Motor is the general visceral efferent column. Means all pharyngeal arch one origin muscles supply by this trigeminal nerve. Second sensory is the GSA column. Means general somatic efferent. Means all head and neck supply, sensory supply coming from this GSA column, means trigeminal nerve. Now these two components are originating from this sensory component coming from this long nucleus. This nucleus is called trigeminal nucleus. Trigeminal nucleus. This is the huge sensory nucleus which situated from midbrain up to the spinal cord. So this nucleus, trigeminal nucleus, having three components. First component in the midbrain is the mesencephalic nucleus. This mesencephalic nucleus is for the jaw reflex and proprioception. This is for jaw reflex and proprioception. So this is mesencephalic nucleus. First part in the midbrain of trigeminal nucleus is called mesencephalic nucleus. Second sensory part is the chief or principal nucleus. This chief and principal nucleus is situated in the pons. This is for touch and pressure. Touch and pressure. So any touch and pressure sensation coming from the head and neck part going into the chief or principal nucleus. Third part is the spinal nucleus of trigeminal nerve. This part for the pain and temperature. So any pain and temperature sensation going into this spinal part of the trigeminal sensory nucleus. So three part mesencephalic nucleus. This mesencephalic nucleus is also site of only site in the pseudo unipolar neuron in the brain. So mesencephalic, principal and spinal nucleus, three part of this sensory nucleus of trigeminal is supplying different sensation of the head and neck. So this is the sensory nucleus. Motor nucleus is situated in the mid pons, and this motor nucleus is supplying the general visceral efferent column. Means all muscles of mastication and four other muscle of the non-masticatory supply coming through this nucleus, that is motor nucleus of trigeminal nerve. So if you see this three part of this fifth cranial nerve, sensory part and one motor, This motor nucleus is going separately. You can see this merges in the just below the foramen ovale. It means these two, V1 and V2, ophthalmic and maxillary branches are absolutely sensory, and this mandibular become mixed after this foramen ovale because this motor supply going just below the foramen ovale and merges with the mandibular nerve. So only mixed nerve is the mandibular branch. These two, V1 and V2, is absolutely sensory branches. So this motor nucleus having fiber about 8 to 10,000 nerve fibers. While this spinal nucleus, this is huge nucleus having fibers about 1.7 lakh or 1.8 lakhs fibers. It means this only 5 to 10% part of this trigeminal nerve is the motor. Rest 90% of this having the sensory part. While in facial nerve 70% means 7,000 bundles are the motor fibers which supply the facial expression muscles, and 3,000 fibers are the sensory fiber. This is opposite. Huge part of this is the sensory only. Now this muscle also having topographic relation of the all four ganglia of the parasympathetic column. Okay, we will talk about this one by one. Now after developing from the midbrain, pons and medulla, these sensory fibers are coming separately and this motor fiber coming separately till the just below the foramen ovale. This sensory part of making one ganglia at the petrous apex. This ganglia is called the Gasserian 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 ganglia or semilunar ganglia. Semilunar ganglia or trigeminal ganglia. This is if question asks, this trigeminal ganglia is absolutely sensory. There is no fiber of any motor component because motor component is going separately. This trigeminal ganglia at the petrous apex having one fold of dura mater like a pouch like this. This pouch of this Gasserian ganglion which made by the dura mater is called Meckel's cave. Meckel's cave. Okay. So this pouch of dura mater which contains the Gasserian ganglia is the Meckel's cave. If you know this trigeminal nerve concept, you will cover almost more than 50% of the skull base. Because in skull base surgery, this branches and this trigeminal nerve is very important. Second nerve is the facial nerve, which is important in the skull base surgery. After origin this Gasserian at the petrous apex here, if you see this picture, this is the petrous apex, this is the occipital bone, and this is the body of sphenoid. So here this ganglia is situated. After this divided into three branches. First branch is the V1, that is ophthalmic. Second branch is the V2 maxillary, and third one is the mandibular branch. This first branch and second branch going through very important structure, that is cavernous sinus part. So cavernous having in lateral wall, V1 going above, V2 going below, in the lateral wall of cavernous sinus. So any cavernous sinus thrombosis, affected branch of trigeminal is V1 and V2 because V3 is going separately. This V1 going to superior orbital fissure. This is superior orbital fissure. V2 going into the foramen rotundum. And this V3 going into foramen ovale. So these three branches going separately. but V1 and V2 going in lateral wall of the cavernous sinus, and any pathology in cavernous sinus can affect this V1 and V2 because these are going in the lateral wall of the cavernous sinus. Now we will talk about individual branches of this V1. After passing through cavernous sinus, this ophthalmic division divided into three branches just before passing into the superior orbital fissure. See, this is superior orbital fissure here, just below the optic foramen. And this first branch of this is the frontal nerve. This is the most superficial and central branch is the frontal nerve. This frontal nerve passes just above the orbit and below the orbital roof and making two branches, superior trochlear branch coming out as a supratrochlear branch and supraorbital branches which supply this part of the forehead. Second branch is the nasociliary nerve. Nasociliary nerve. So first branch, frontal nerve having two main branches, supratrochlear and supraorbital branches. Second is nasociliary nerve. This nasociliary nerve is situated medially and deep to this frontal nerve. And this nasociliary crosses the frontal nerve medially in the mid part of the orbit. So here, before crossing, this nerve topographically having one ganglia. This ganglia is called ciliary ganglia. This ciliary ganglia having some branches. These branches are called short ciliary nerve. This supply short ciliary nerve supplying the ciliaris muscle and sphincter pupilli. This ciliaris muscle can change the diameter accommodation of this lens. Diameter of this lens. This is ciliary muscle. Sphincter pupilli which supply the pupil that can change constrict the pupil. So this component short ciliary nerve post ganglionic fiber. Short ciliary nerve supplying the ciliaris muscle and sphincter pupilli. But this supply is not coming from the this nasociliary means trigeminal nerve. This is coming from the oculomotor nerve. Because this oculomotor nerve is situated here and fiber of functional component of this oculomotor is going through this ciliary ganglia through this nasociliary nerve because it is topographically situated here and these fiber of oculomotor coming from the midbrain by the Edinger-Westphal nucleus. Edinger-Westphal nucleus, which supply this ciliaris muscle and this sphincter pupil. What is difference with topographically functional? See, this is the nerve. This is the nasociliary nerve. Topographically, this is related to the this trigeminal nerve, but functional component are coming through this oculomotor nerve like this, and they relay here. Means functional component coming through this oculomotor nerve, and these fiber again goes through this short ciliary nerve. So this is topographically means anatomy morphologically it related to the trigeminal nerve, but functionally coming through Edinger-Westphal nucleus or third nerve, oculomotor nerve, and supplying the ciliaris muscle and sphincter pupillate. This ciliary branches, which is short ciliary, this turns upward or medially, and this supply this nasociliary having two branches of this continuation. This is posterior ethmoid nerve, which posterior ethmoid nerve is going along with the posterior ethmoid artery, and this just anterior to this another branch is the anterior ethmoid nerve. This nerve going along with the anterior ethmoid artery. This supply the middle and anterior ethmoid sinuses, and this supply the posterior ethmoid sinus and sphenoid sinus. So this is sensory supply of the sphenoid sinus and anterior middle ethmoid sinus and some part of the roof of the anterior skull base. And this also supply the meninges of the anterior cranial fossa, because these branches are also going into the anterior cranial fossa. After this branch continuously going on the medial aspect, forming the continuous part of this nasociliary nerve, forming the IT, means infratrochlear branches. Here this supply the infratrochlear part of this uh, medial canthal skin. So this is all about this nasociliary part. Third branch of this ophthalmic is the lacrimal nerve, which supply the this part lacrimal gland part, and one branch going into the upper eyelid of this lateral surface, supplying the lateral aspect of the orbital skin. So this is the lacrimal gland. But this lacrimal gland is only having this functional component. Main secretory component of this coming through one connecting branch of the facial nerve through the median nerve, that having secretory component in this. Okay, so this is coming from B2 part. So one connecting branch. I will tell you when we will discuss the maxillary nerve. So this three branches, frontal nerve, nasociliary nerve, and lacrimal nerve is the component of the ophthalmic. Now coming to the second division, V2. V2 is coming through foramen rotundum. So this is the foramen rotundum. It's going into the spinopalatine foramen or pterygopalatine fossa. So this part here is the foramen rotundum, and it's forming one ganglia, that is in the spinopalatine ganglia or pterygopalatine ganglia is the same thing, and the spinopalatine foramen. So this coming through foramen rotundum forming one ganglia, that is spinopalatine ganglia. This ganglia having multiple branches. After passing through continuous branch of this is the infraorbital nerve, because just below the orbit this becomes infraorbital. Continuation of V2 is forming the infraorbital nerve, and this divided multiple branches to supply this maxillary or malar area of the face sensory component and into the infraorbital nerve. This infraorbital nerve having multiple branches. First branch downwards coming into is the nasopalatine nerve, lesser palatine nerve, and greater palatine nerve. And branches which supply the maxillary sinus or upper alveolar process or teeth are the three branches. Superior alveolar nerve. This posterior branch is called posterior superior alveolar nerve. This mid part is called middle superior alveolar nerve, and this anterior part is called the anterior superior alveolar nerve. So this is very simple to remember. Three branches of superior alveolar nerve, posterior, middle, and anterior. Okay, and one branch going above. This branch is called GTN. JTN means zygomatico-temporal nerve. This ultimately divided into zygomatico-facial and zygomatical-temporal. Upper branch is zygomatico-temporal, which supply this temple part of the skin, and zygomatico-facial, which supply this zygomatic skin. So these two branches, but one branch is connecting branch, which supply this lacrimal gland through facial nerve, because median nerve coming here from the greater superficial petrosal nerve having parasympathetic supply to this lacrimal gland. So this GTN having connecting branch which supply this, because already this nerve is going through, reaching up to lacrimal gland through this trigeminal branch. So why do facial go here? So facial come up to this spinopalatine ganglion and postganglionic fiber supplying this through this trigeminal branches. Now last branch is the mixed branch, that is mandibular nerve. This mandibular branch having multiple branches. So just below the foramen ovale, this is the foramen ovale, and just below here, this foramen ovale merges branches of motor component and forming the main trunk. This main trunk of mandibular nerve having three branches, mainly two branches of main trunk. First branch is nerve to medial pterygod. This nerve to medial pterygod muscle also supply. So first branch from the trunk is the median pterygod, medial pterygod muscle branch, which also supply the levator veli palatini and tensor tympani muscle. So this nerve to median pterygod also supplying the levator veli palatini and tensor tympani muscle. Second branch of posteriorly is coming from this main trunk is the nervus spinosus or recurrent branch of the meninges, which supply the meninges or dura mater of the middle cranial fossa. So this branch also called recurrent meningeal branch of the mandibular division, that is called nervus spinosus. This nervus spinosus going through this foramen. This foramen is foramen spinosus, and through this one branch of middle meningeal artery going. So foramen ovale having this main branch, and foramen spinosus or this foramen spinosus supplying the recurrent nervus spinosus. Okay, or recurrent branch of this mandibular main part, trunk part. So two main branches, median pterygod and recurrent branch of meningeal, which supply the middle cranial fossa dura mater. After this main trunk divided into anterior division and posterior division. And anterior division supplying the, mainly it is motor, supplying the masseter muscle, nerve to masseter, and nerve to lateral pterygod muscle, and second division supplying the nerve to mylohyoid, which also supply the anterior of digastric. This anterior division having mainly motor branches, but one branch is buccal branch. This buccal branch is separate from the facial nerve branches, because this buccal branch of facial is coming here, divided into upper and lower buccal. That is the motor branch. But this buccal branch of trigeminal nerve is the sensory branch, which supply this buccal or oral cavity or buccal skin part of the sensory supply. Posterior division of this trigeminal nerve is having three main branches. First branch is this branch is going posteriorly, that is auriculotemporal nerve. This auriculotemporal nerve bifurcate in middle, having loop. Through this loop is one artery going into the foramen spinosus, that is middle meningeal artery. Second branch of this posterior division is the inferior alveolar nerve. And third branch is lingual nerve. This lingual nerve again having parasympathetic component, that is submedullary ganglia. And this just below the foramen ovale, one ganglia is situated here. In the middle part of the trunk is the otic ganglia, which supply the parotid gland through the auriculotemporal nerve. So, four parasympathetic ganglia are submendular ganglia, otic ganglia, spinopalatine ganglia, and this ciliary ganglia. These supply from different nerve, and but topographically these are related to the trigeminal nerve. So this concept of trigeminal nerve is very important. You should know at least this in these branches. I think this will cover about 50% of the scabies. So this is all about trigeminal nerve. Thank you so much.